Okay, how are you everyone? I'm going to talk about the clinical evaluation of the patient. Nowadays, we do have a lot of investigation and imaging method, so that the clinical method is seems to be undermined by now, in my understanding. So there would be some clarification on that. Herophilus of Alexandria quoted sometimes that the best physician is the one who is able to differentiate the possible and the impossible. So, from this, classical Greek times interrogation of the patient has been considered most important because disease was and still is viewed in terms of the discomfort it causes. However, the current emphasis on the use of history techniques for diagnosis developed only in the 19th century. Also, terms like symptom and signs have been part of the medical vocabulary since the revival of the classical medicine, and relatively recently they were used synonymously. So they were used interchangeably like symptom and signs, but the difference symptoms is that the patient complains, and the signs is what the physician will get on physical examination. During the 19th century, the distinction between symptom, subjective complaint, which the clinician learns from the patient account of his or her feeling, and the signs, objective mood changes detectable by the clinician, evolved. Until the 19th century, the diagnosis was empirical, based on the classical Greek belief that all disease had a single cause and an imbalance of the four hormones. Yeah, they called four hormones, what we call yellow bile, black bile, blood, and phlegma. Indeed, the Royal College of Physicians, found in London and the British, believed that the clinical response without classical learning was useless, and the physicians who were college members were fined if they described to any other views. At the time of Hippocrates' observation and feeling had a place in the examination of patients, the ancient Greek, for example, noticed a patient with jaundice often had largely that are there. So we will continue as some historical findings.